When life throws a curveball seeking help for psychological problems, life can be tough. We face challenges every day. Sometimes these challenges feel overwhelming. We might feel lost, confused, or just plain stuck. These feelings can be signs of a psychological problem. Everyone goes through tough times, but when these issues start to affect our daily lives, it might be time to seek professional help. Think of it like this. If you had a persistent pain in your chest, you wouldn't ignore it, right? You go see a doctor. Similarly, when you're struggling with your mental health, reaching out to a trained professional is crucial. These professionals are trained to understand the complexities of the human mind and can provide the support and guidance you need to navigate difficult emotions and situations. Seeking help is not a sign of weakness, it's a sign of strength. It takes courage to acknowledge that you need support and to take that first step towards healing. Remember, you don't have to go through this alone. Life can feel like a maze sometimes, especially when dealing with mental health issues. That's why reaching out for help is so important. It's about getting the support you need to find your way back to a place of strength and well-being. Navigating the maze, understanding mental health professionals. When it comes to mental health, there are a variety of professionals who can help. It's like a team, each with their own area of expertise. Let's break it down. First, we have psychologists. These are highly trained professionals who hold a doctoral degree in psychology. They specialize in understanding how people think, feel, and behave. Psychologists use talk therapy to help people identify and manage their mental health challenges. In some states, they can also prescribe medication. Next, there are psychiatrists. These professionals are medical doctors who have specialized training in mental health. They can prescribe medication and often treat the most severe mental health conditions. Then we have counselors. These professionals typically have a master's degree in counseling and provide support for a wide range of issues, from everyday stress to relationship problems. Other important members of the mental health team include social workers who help people connect with resources and navigate social systems, and psychiatric nurses who provide direct care to individuals with mental health conditions. Remember, finding the right mental health professional is like finding the right shoe. It needs to fit your unique needs and preferences. Don't be afraid to ask questions and shop around until you find someone you feel comfortable working with. The healing conversation, psychotherapy and its goals. Now let's talk about psychotherapy, often referred to as talk therapy. This is a cornerstone of mental health treatment. It's a collaborative process where you work with a therapist to explore your thoughts, feelings and behaviors. The goal? To develop healthier coping mechanisms and improve your overall well-being. Think of it like this. Imagine your mind is like a garden. Sometimes weeds can grow and choke out beautiful plants. Psychotherapy helps you identify those weeds, those negative thoughts, feelings and behaviors, and gives you the tools to uproot them. One of the most important aspects of psychotherapy is the relationship you build with your therapist. It's a safe and confidential space where you can be completely open and honest without judgment. This trust is essential for the therapy to be effective. Remember, psychotherapy is not a quick fix. It takes time, effort and commitment. But with the right therapist and the willingness to put in the work, it can be a transformative journey. Section 4, the therapist's toolbox. Qualities of an effective therapist. Finding the right therapist is crucial for successful therapy, but how do you know if a therapist is right for you? What qualities should you look for? Firstly, an effective therapist is someone who genuinely cares about your well-being. They have empathy and compassion, creating a safe and non-judgmental space for you to open up. You should feel heard and understood by your therapist. Secondly, a good therapist is an excellent listener. They pay close attention to what you say, both verbally and non-verbally, to understand your perspective and experiences fully. They don't interrupt or impose their own opinions. Thirdly, an effective therapist is knowledgeable and skilled in various therapeutic approaches. They can tailor their methods to your unique needs and preferences, ensuring you receive the most effective treatment possible. Finally, a good therapist is someone you feel comfortable with. You should feel a sense of trust and rapport, allowing you to be open and honest throughout the therapeutic process. Remember, you're the one who will be working closely with this person, so it's essential to choose someone you connect with. Section 5, Beyond One-on-One, Exploring Group and Family Therapies. While individual therapy is a common approach, it's not the only option. Group therapy and family therapy offer unique benefits and can be incredibly valuable for certain individuals and families. Group therapy, as the name suggests, involves a small group of people facing similar challenges. It provides a supportive environment where individuals can share their experiences, learn from others, and develop new coping mechanisms. Imagine it like this. Think about a time you felt alone in your struggles. Now imagine being in a room with others who understand exactly what you're going through. That's the power of group therapy. Family therapy, on the other hand, focuses on improving communication and resolving conflicts within families. It helps family members understand each other's perspectives, develop healthier communication patterns, and strengthen their bonds. Both group and family therapies highlight the importance of connection and support in healing and growth. They provide a space for individuals and families to learn, grow, and heal together. Section 6, the biological angle. Biomedical therapies for mental health. While therapy focuses on our thoughts, feelings, and behaviors, biomedical therapies address the biological factors that contribute to mental health. These therapies, typically administered by psychiatrists, include medication, electroconvulsive therapy or ECT, and in rare cases, psychosurgery. Medication plays a crucial role in managing various mental health conditions. For instance, antidepressants help regulate mood, anti-anxiety medications reduce anxiety symptoms, and antipsychotics alleviate symptoms of psychosis. ECT, often misunderstood, involves passing a small electric current through the brain to induce a brief seizure. While it sounds intense, it's a safe and effective treatment for severe depression, bipolar disorder, and certain other conditions when medication and therapy haven't been successful. Psychosurgery, involving brain surgery to address mental health issues, is extremely rare and only considered in extreme cases when all other treatment options have been exhausted. It's important to remember that biomedical therapies are not a one-size-fits-all solution. The type of treatment recommended depends on various factors, including the specific condition, its severity, and individual needs and preferences. Section 7. A look into the mind. Psychoanalysis and psychodynamic therapy. Delving into the depths of the unconscious mind, psychoanalysis, pioneered by Sigmund Freud, explores how past experiences, particularly from childhood, shape our present thoughts, feelings, and behaviors. Imagine an iceberg. The tip above the water represents our conscious thoughts, while the vast mass below the surface symbolizes our unconscious mind. Psychoanalysis aims to bring those hidden thoughts and feelings to light. One of the key techniques used in psychoanalysis is free association, where the patient speaks freely about whatever comes to mind, allowing unconscious thoughts and feelings to emerge. Psychodynamic therapy, a modern approach influenced by psychoanalysis, focuses on how unconscious processes affect current relationships and patterns of behavior. It's a more focused and time-limited approach compared to traditional psychoanalysis. Both psychoanalysis and psychodynamic therapy offer valuable insights into the hidden workings of our minds, helping us understand the root causes of our thoughts, feelings, and behaviors.